I'm producing a one-man show right now for the Fringe Festival, and I had caffeine and I was getting ready to get our programs ready to go to the printer, and our show was opening in 2 hours. And the dyskinesia and then the adrenaline of the stress, I was stiffening up and then shaking at the same time so badly that I missed the premiere. Like, I could not get it together. I knew about dyskinesia as a side effect from the debate that was happening about when early onset people should start taking it. And so it's hard for me to explain to friends that when I'm moving like this and I'm a little bit wiggly right now, this isn't the Parkinson's, this is the drug.
There's no way to be absolutely predictive of who's going to get into trouble and who isn't going to get into trouble. But overall, the younger patients are more likely to get into trouble with dyskinesias. That makes it almost worse, because these are the patients who have the longest life to live with PD.
When I was first diagnosed with Parkinson's, I had a slight tremor in my left hand. Well, I've been pretty healthy most of my life, and I was flying an airplane. Did that for about 20 years, and I was also racing cars at the time. And so I was a little concerned about taking medication if it wasn't going to cure the disease or reverse it or something. But also the dyskinesia, it seemed like, that was kind of the wall where, the drug would work for a while and then it lost its effectiveness and you had to take more of it, you'd start developing the dyskinesia, which, seemed almost as bad as the disease at that point.
The biggest challenge facing the symptomatic treatment of Parkinson's disease is to try to get the optimal therapeutic benefit while minimizing the side effects. So what we know is the best drug for getting the symptomatic benefit is levodopa, but it's the one most linked to side effects like dyskinesia. So what patients do now with their doctors is really work on building a cocktail of treatments using levodopa, but also some of the dopamine agonists, the MAO-B inhibitors like Azilect, to really try to get what they can get in terms of the therapeutic benefit while minimizing the side effects.
When dyskinesia sets in, it kind of puts a halt on plans. I know at times my mom would feel bad about going out and sitting with people at dinner and making them feel uncomfortable.
If we could control dyskinesias, it would probably be the biggest change in terms of how we treat patients. They're living with disability they shouldn't be living with because they're terrified, and they delay the treatment, and you're basically not doing right by the patient. Discussing, whether amantadine or, surgery really take care of the problem, they don't. They really don't.
There is hope. There's all kinds of ways that you can look at this disease, but certainly, it's better than most things you can have, and I think that I just want to have the best quality of life that I can have.
So if we had a treatment that limited these side effects like dyskinesia, it would really dramatically change the ability of people to live with Parkinson's disease today.
I think if dyskinesia can be controlled at all times, it would give people more freedom.
It would be life-altering to be able to have the benefits of Sinemet without the dyskinesia, because I think it would get those of us, especially with early onset Parkinson's, to have the closest proximity to normalcy that we would have.